Questions here. And Kim, you'll be on.
Are you going to say go, or how will I know go?
We're live.
Oh, wonderful. We are going. Thanks, team. And I'm seeing the participant count grow and grow. This is Kim McCoy-Wade at the California Department of Aging. I'm going to watch those numbers climb just a little bit more as we welcome all of you to the table for our check-in call, our second check-in call in a new series designed to support family and friends. This week, we're going to focus on caring for our family and friends. Well, actually, the title slide says in your home, but that's not what we're doing today. We are doing caring for an adult or from afar today. We did in your home last week, and that's recorded, and you're welcome to view that on our webpage. But today we are doing caring for an adult from afar. Am I right on that?
Yes, sorry about that.
Good. I'm so glad I'm in the right place.
Yes, you are.
Good. And by that, we mean all the kinds of ways that we are providing care. We are providing care across town for our loved ones, some of us across the country, and some of us for our loved ones in assisted living. And I'll just share a personal story that I have all three of those in my life right now. So this webinar is of particularly importance to me as we talk about how to care in this unprecedented time. We are so fortunate to once again be joined by Alzheimer's Association sponsoring the series and developing the series, and the wonderful expertise of Edie, and then from our Ombudsman program that we has a national program and a California program, and one of our shining stars is Nicole Howell for her leadership of the program in Contra, Costa, Alameda, and Solano counties. And we are so grateful that Nicole is here to really share also from what's happening right now. In facilities, with families, in communities. It's changing every day. It's one of the most urgent and essential topics in all topics about aging and disability right now. And so we're so glad that we have this space together to talk and to learn and to ask your questions. I'm going to just go ahead right now and give the plug that questions are welcome anytime at our email box. We will flash that in just a second for those of you who are watching. But those of you who are listening, it's engage, E-N-G-A-G-E, engage at aging.ca.gov. We are standing by right now to check those emails and read as many as we can online to get Nicole and Edie's thoughts and information on that. I do want to come back and say, while this topic is of a special importance and special urgency right now, as we all look at data, on what's happening with outbreaks, new needs for communication, increased isolation among residents separated from family and friends, and all the many, many needs. There are other series in this topic. Next week, we'll be talking about essential conversations. How do we talk about planning for your care and serious illness? And once again, we'll have experts in the field from UCSF and Coalition for Compassionate Care sharing COVID conversations and toolkits and more. And then the final one in this series at this point is the Wednesday, May 6th, caring for yourself while you're caring for someone else. I hope everybody is finding time to do it, which is very challenging, but we of course have to find new ways, and we have new stressors. So stress relief and respite will be the focus of that. We are also here at CDA looking for more and more ways to stay connected. We hope you are on our Let's Stay Connected listserv. Again, you can go to engageca.org. to get all the information about how we're staying connected. We have this series right now on caring for family and friends. We're starting another series around technology. Technology is more and more important that we close the digital divide. And the first webinar on that is tomorrow. Tomorrow afternoon, we will have a webinar led by our colleagues San Diego, Oasis San Diego, with some tips for providers and others who work with older adults about helping older adults get online, and if they are online, do even more. We know how critical technology can be to staying connected, to telehealth, to ordering groceries and other needs. So we want to help close that digital divide, and I know that topic will come up today of a special concern, again, supporting our loved ones from afar. But more to come, so much more to come. May is Older Americans Month, and we are looking forward to really lifting up all the way that older Californians are making their mark, being heroes, staying home, and saving lives in California. But today, let's create space for family and friends, caregivers. Let me welcome you, and let me again turn it over to our really superstar panel of Nicole Howell and Edie. Thank you so much for joining us today.
Thanks so much, Kim, for that introduction and for leading this check-in. I really appreciate it. I'm happy to be on. My name is Edie Yao. I'm from the Alzheimer's Association. And today we are talking about caring from afar. So just because you don't live with the person you are caring for or even live nearby doesn't mean you cannot or don't provide care. And in current circumstances, there are many people providing care from afar. Some may be new to this and some may have been doing this for quite a while. There are many ways to provide support from a distance, such as providing emotional support, making medical appointments, or researching and arranging services in the community, or managing finances. And I also want to put in just recognizing that not all older adults need care. We've had that comment before. And in fact, there are many of us who've taken it upon ourselves to suddenly dictate or determine what our parents or elders should or shouldn't be doing. That may be unwanted advice. But I do like to think that the pandemic can teach us to be more interdependent and supportive of the people who matter in our lives. And of course, there is a spectrum of care needs based on individuals. In this hour, we'll provide guidance for those who do need more assistance, whether they live at home or in a senior living community. So let me start with things to consider when you're caring for someone who lives in their own home. So in the community, their own apartment or home or wherever, but they live independently. So how do you monitor the care for someone who lives remotely? The first thing is really keeping that communication going. Even from afar, you can coordinate many moving parts, whether with informal caregivers such as family and neighbors, or with home health aides and other services. It's important to set aside time to regularly discuss the needs of both the person that you're concerned about and also maybe even the caregiver. So in many instances, people are caring for both parents, perhaps, and perhaps, one of the parent has dementia and the other parent is the caregiver. It's important to check on both of them. So the types of check-ins are, I advocate for phone calls, phone check-ins. I think they're preferable over email because you can gauge how someone's doing by not only what they're saying, but their tone of voice and how chatty they are. And the conversation is far more fluid than by email or by text, right? I mean, texting is pretty truncated, pretty brief. Often you might get a one-word answer, but phone check-ins are great, as are video chats or FaceTime. Those are also really helpful. You also want to think about asking a neighbor to check in. When my kids were in, I think even in high school, but particularly I remember elementary school or middle school, one of the things that we'd have to do for every year is fill out an emergency card. And they would ask you to indicate two or three emergency contacts. And they specifically asked for people who were walking distance from the school. So while I would think of my parents, my kids' grandparents as the emergency contacts, they would have to drive, even though they're in the same county, they'd have to drive over if there was an emergency. And the school was specifically asking for contacts that were walking distance. And I think that's a really good recommendation, is to think about who in the neighborhoods, who is nearby that living near this relative that you could call on just to check, to visit or be nearby. The communication piece in terms of how frequent, I certainly think weekly is warranted these days, but for some it might even be daily. And again, FaceTime or video chat are great options in addition to phone or in place of phone. I've heard of many families now doing a regular Zoom meeting where they have all the family members together. So it creates not just a one direction, I'm checking on you, but let's all communicate and let's see how everyone is doing. The other tip is to make sure prescriptions are filled. And I'm sure you may have thought of this already, but you know, caregivers can ask their pharmacist or doctor about filling the prescriptions for greater number of days to reduce the trips, or have them mailed, which is a great option these days. You can also call the healthcare provider. And so if the person you're caring for has regular doctor appointments to manage health conditions or anything, you know, you can call and inquire about a telehealth appointment. And Medicare has recently expanded telehealth benefits to allow seniors to access healthcare from the safety of their homes. And my father-in-law just had one of those telehealth calls. He had an appointment with the memory clinic, and the internist did a phone chat with him. And we had specifically asked my husband to get a follow-up from that internist, and so they were able to communicate. Those are all good ways to monitor the care of the person that you're concerned about. The other piece is reassess care needs during each visit or check-in. And what I mean about that is, well, I want to talk about dementia for a moment, because while dementia is not a normal part of aging, it does affect 1 in 10 seniors and nearly 1 in 3 over the age of 85. But as dementia progresses, the level of care will need to be adjusted over time. And so people start to need increasingly more supervision and more monitoring and more assistance. So every time you check in with this person, assess the situation to make sure that your family member, in this case with dementia, that their needs are being met, and also checking in with the person who's providing that day-to-day care. So the questions that are good examples of what to think about during these check-in calls is, you know, is the person eating regular meals? Is there food in the refrigerator? Are they getting groceries delivered? Is someone picking up groceries for them? Is there food in the fridge? And also think about what's the condition of the house, the home, whether it's inside, outside. This is where video chat, FaceTime can be really helpful, just to get a sense of what's the home looking like these days. Are the bills being paid? Is there a pile of unopened mail? Do you have access to help pay their bills online? Can you help them set up online bill payments? Does anyone visit regularly? So in addition to your calls, are there other friends or family members that your relative or friend talks to on a regular basis that are still making those calls? Because social isolation is a really big issue right now, and we want to make sure people are hearing from multiple contacts. So not having you be the only person that they're in touch with. What's the person's personal appearance looking like? So video chat's great for this, right? You can see is someone still grooming and doing their regular grooming? Are they still just taking care of themselves? And then also just checking in on the people who live with them, perhaps. Again, I think about caregivers caring for someone with Alzheimer's, that a lot of times these caregivers are having a hard time because they might have had relief before, but now they're not. And then a couple other thoughts is gathering pertinent information, keeping it handy, all of that contact information about physicians, pharmacies, care providers, neighbors. It's important to have financial and legal documents easily accessible or know where they are in case of an emergency. And then communicating remotely. So I just want to talk a little bit about the actual communication, because I want to just mention it's not just about getting the task done. It's really, you want to make sure that the person you're thinking of knows that you care about them. Again, the social isolation piece is huge right now, and just knowing that you care about them, tell them that you love them, is so important right now. And keeping a positive attitude when you're having those conversations. And again, I think about people with dementia who may not be able to have lengthy conversations about current events or what's going on right now, but reminiscing is certainly helpful. And hearing from you and just reflecting on some stories is a great way to connect. So that ongoing communication is also about just connecting. And you can also send snail mail, send food or cards. Those are all great ways to reach out as well. And other resources, there are lots of resources on engageca.org that you can check out, and also check out 211 for food delivery options. So many different resources to think about. We certainly have a lot here in California, but I would start with engageca.org for resources. And then my last piece of advice, if you will, is I think it's always important to just remind people to ask for help and to accept help. And so, well, you may feel like you're stranded. I can't physically get there, or I'm trying to, do my best to monitor my mom's care. Again, think about the people who live nearby, and think about other siblings who are also around that you can take turns. You can share the support of caring for this person. And when people do ask, let me know how I can help, how can I help, that you have your list ready. Particularly people who live nearby, or even friends, asking them to call and check in on a regular basis. Those are all really critical to keeping this person feeling connected. So don't underestimate the importance of supporting your family or friends from a distance. There's certainly a lot that you can do with the technology of phone, video, email, all kinds of things. So I'm going to stop there, and I'll turn it over to Nicole Howell to talk about considerations for senior living settings. And again, if you have any questions, please email them to engage@aging.ca.gov. So take it away, Nicole.
Excellent. Well, thank you, Edie. I appreciate that. Those were important tips. And I want to remind everyone that the Engage website, which is engage.ca.gov, has a helpful list of FAQs that you can look at, that some of the things we've referenced. So if you do want to go back after the conversation, you can feel free to look there. So I run what's called a long-term care ombudsman program, which means that my team members work with individuals who live in long-term care. And I know that during this time, this is especially uncertain for those of you who have friends and family in facilities and cannot go and visit them in person, and are struggling to find ways to ensure that they're getting the appropriate care that they need and still maintain connection with them. So first and foremost, I just wanted to say, I really appreciate that so much, how challenging it is right now. And you were doing a great job by trying to connect with them. So really this time, I'd like us to take a step back and think about connection and engagement, not necessarily physical presence. So first we're going to look at what you should do in terms of your communication with facilities. And so you obviously help to support someone in a facility because they needed extra care that couldn't be provided at home. And so first of all, I want to say, trust in the decision that you made. That when you looked for a facility, you kept in mind who the individual is, who could best meet their needs, and where they would be able to flourish. And really lean into that you made a good decision about where you place them. And the people there at that facility, you're going to be able to partner with them to ensure they're getting the best possible care. However, you absolutely have the right to be getting information not only about what the facility is doing broadly to engage with their residents, to prevent the spread of COVID-19, but also how they're communicating with families. And so it's important that as early on as possible, you're setting some good expectations with facilities about how and when you're going to communicate with them. So regulations are changing on a daily basis. And as we know, facilities, some of them are short-staffed. So if I were a family member, these are the series of questions that I would consider. So first of all, ask the facility who should be your primary point of contact. The administrator may not be able to ask and answer all your questions at a given time, and they may have dedicated a specific staff member to respond to questions. So find out who you can connect with and how is it best to connect with them. Is that phone or email? Keeping in mind that a facility is trying to work with all family members while still delivering care, and they may not be able to take a phone call every day, but they could agree to maybe email communications, and that might be a better way to answer your questions. You can also ask, how frequently will the facility be communicating with you? So will the facility be sending information out to families on a daily or weekly basis? Or will you not be hearing from them unless there's a concern? And you have the right to request that communication, being clear that what you're wanting is information, but doing your best to maintain an open and collegial relationship with the facility. It's important to remember that during this time, tone is very important. That again, as I said, facility staff can be overwhelmed. And so if you start the relationship on an open note, that you're seeking information, but that you're not seeking to indict the facility, I think you'll find it to be a fruitful relationship. Just really realizing that none of us are at our best. I certainly could really sort of feel what Edie was saying about, on some of my best days, I'm a little more anxious and I might be a little more overbearing with my parents about making sure they don't go outside. And I have to remember that facilities, when my ombudsman working with them, are struggling too. And so if we're all going to come out of this together and take care of residents, we have to really come from an open position. So as I've said, the point is to really engage with the facility and find out what you can expect from them and make clear your expectations, how you want your family member to be cared for, and what communication you are needing. As I said, you need to keep in mind that rules are changing daily. And if you would like to see the continuing guidance that facilities are being given, you can visit my website at ccombudsman.org. There's a COVID-19 section, and it links directly to the regulations, which are continually updating. So if you'd like that information, you can find it there. But I think what so many of you are likely looking for is, how do I connect with my family member? How do I maintain a relationship when they can't see me? And I think it's no more relevant as we think of those individuals who might experience dementia. And it's very important that we maintain that ongoing connection. So I think as a family member, it's best if you think of how you can support the facility. So you might ask the facility, what are their needs? How can you as a family member support activities? So I've seen examples recently of family members or family councils spearheading sort of outside parades where everyone drives by and honks horns or has balloons and sort of creates an event for the facilities that they can work with the residents on. Ask if you can continue, is there supplies that they need that you could maybe drop off? Can you bring your residents' favorite cookies or treats and leave them outside so they can be cleaned and disinfected and then given to them? Keeping in mind that any kind of support you offer or any kind of engagement will go a long way to supporting morale and care in the facility. Offer solutions to facilities. Gosh, if they're struggling to connect with you, if you have an extra tablet, see if you can donate that to the facility that will facilitate communications. Make clear that what you're wanting to do is engage with your family member. But I will say, if you are encountering challenges and you're not able to connect with your family member, that is the perfect time to reach out to your local ombudsman's office. It's important to remember that while facilities might be taxed, that they do have a responsibility and have been directed to facilitate ongoing communication, be that phone, be that video, be that activities with the outside community. I saw a news story of a local facility that had built sort of a plexiglass box for residents to be in so they could sit and engage in conversation with their family member safely. And I think that's the kind of creative thinking we're seeing from some facilities. But if the facility you're working with is not thinking outside the box and you're wanting to spearhead that, that is a great time to reach out to your ombudsman and talk about how you can find solutions. So I want to say again, for those of you on the phone, if you'd like to email us questions or something's coming to mind, take a minute and write an email to engage@aging.ca.gov. I also want to add that at the Engage website, there's continually FAQs, which I think we're going to talk about later, which is some of the questions around if and when you should choose to take someone out of a facility, or how you'll be notified of if there is a positive COVID-19. So I think some of the questions you do have is, if there is an outbreak in a facility, what and when will I hear from facilities? Well, the requirement is that a long-term care facility has to notify local public health and their local licensing entity. However, in recent days, there has been additional guidance that facilities will also be notifying the Center for Disease Control, and they also should be notifying families in that situation. So if your family member is at a facility where there is a positive COVID-19 case, facilities have been directed to notify the residents and responsible parties of the other individuals. They will not be able to name who has COVID-19, that's a privacy violation, but they should let you know if they do have an outbreak. And then of course, at that point, you have the right to ask, what are they doing to prevent the spread? And you have the right to request answers and seek assistance. Again, it's sort of not what you say, but how you say it. So it's important to remember that the facility may not know all the answers, but you have a right to request an open forum and get that information. So I just want to thank you for seeking to care for your family member from afar. I know that it's challenging under the best of circumstances, and it's especially challenging right now. But your local ombudsman office is here to assist you. And so I want to encourage you to visit the CDA website where you can see listings of all your local ombudsman programs. If you have questions or concerns, or maybe something just doesn't quite feel right, you can feel free to reach out to us, and we are happy to assist you during this time. We too are finding new ways to do our work from a distance, but please know that we are still working with residents and families, even if we cannot be in facilities. So I just wanted to thank you all so much, and Carrie, I'll toss it back to you.
Great. Well, this is Carrie, and I just want to say thank you to Nicole and Edie. Those are really wonderful tips and advice for families caring for someone from afar. We're going to take more questions now, and we have some questions that people have emailed in. I also want, for those of you who are on Zoom, there's a little icon at the bottom that says Q&A. So you could click on that, and if you type your question into that box, it will get to us, and we will read it out for Edie and Nicole. So I'm just going to start with some questions that we got ahead of time. So one person asked, how can I communicate with a relative if they are hard of hearing or have visual limitations? So what are some ideas for communicating with relatives who are hard of hearing or visual limitations?
Well, this is Edie. As far as hard of hearing, my daughter's hard of hearing, and so I feel like I know a little bit more about this one. And by the way, there's closed captioning option for this presentation as well. But closed captions are great, and so if you are doing video chat or FaceTime, those are really helpful because the person can see your face. So it's looking at, the body language, and watching your lips move. So they're able to get input in multiple ways. So those are always great. If you can do video chat, that's really more helpful. Certainly speaker phones are also great. But if you happen to do like a Google Hangout or even through Zoom, you can include the closed caption option, and that way they can also see the words. And then in terms of visually impaired, I think phone is certainly, again, the quality of the sound is great. If you can get good quality, landlines are obviously, the sound is usually better than cell. But that would be my first thought, is just making sure you have good quality in terms of sound for the visually impaired. I don't know if Nicole, you have some other thoughts about that.
Well, I was going to say the same thing, that Zoom has the closed captioning option, and make sure any activity you provide is large enough and easy for people to engage with. But I was also thinking sometimes it's good to go back to some old-fashioned letter writing and make sure that it's large, it's easy to see, it's block lettering, this is time to dust off some old skills that we haven't used in a while, and that might be a fun way to engage.
Great. We have a question from the chat, the Q&A box. What agency in California are nursing homes accountable to? Who is responsible for oversight?
That's a great question. And so I want to say, first of all, so for skilled nursing facilities, they are regulated by the California Department of Public Health. But what you might also be asking is, there's something commonly called assisted living or boarding care. And those facilities are not medical in nature, but they are regulated by California Department of Social Services. And in an instance when there is an outbreak, they would be working closely with their local public health as well. So each kind of facility has its own regulatory oversight. Again, it's either California Department of Public Health for skilled nursing or California Department of Social Services for residential care facilities for the elderly.
Great. Another question is, I'm waiting for the stimulus check that is coming from my family member. Can their facility require that they sign their checks over to the facility to cover the extra costs of care during shelter in place?
Is that for me also?
Yes.
Wonderful. That is a great question, and one we are also starting to hear. So remember, if a facility were to want to increase the cost of care, they would need to be able to demonstrate what those increased care needs are. And because they cannot simply say because someone is getting additional funds, that those are required to go to the facility. Those funds should be used for the resident. So again, if you receive those funds or it goes to the facility, that is at the resident or their responsible party's discretion, and it should not just be given to the facility for their use.
Okay. And Edie, do you have anything to add about the stimulus checks coming for maybe someone you're helping care for who lives in the community? Anything come to mind?
Well, my first thought is make sure someone is checking the mail, and I don't know sometimes if the person has a post office box rather than a mailbox at home. Is someone checking that mail, and just being able to have someone monitor that? That's my first thought.
Yeah. I've also heard that there's some scams going on. So watching out for phone calls from strangers or
That's right.
strange emails or that sort of thing, asking for information on their stimulus check.
And they've explicitly said you should not be getting calls from the IRS about that. So if anyone gets those calls, be alert that it probably is a scam.
Mm-hmm.
Yeah. Here's one about caregiving from afar. So I'm trying to figure out what the rules are in another state where my parents live. how do I get started? And I don't know if this is rules about facilities or rules about just shelter in place orders, but any tips on what you would do if you had someone in another state?
Well, in terms of community dwelling, I mean, I would certainly advise people to check the local Department of Public Health website, right, for their stay-at-home orders or shelter-in-place orders. I think all the local departments of public health sites are they're kept pretty updated, so you can get the latest on that.
Okay.
I actually say you should always reach out and check in with your local Alzheimer's association, that they have a host of information to offer and can often connect you with the local area agency on aging. And that would allow you to really get some great work and just a sort of jumping off point.
Thanks, Nicole. Absolutely. That's Alzheimer's Association is, of course, a great resource as well, and your area agency on aging.
Okay, so here's a question about supporting someone in town. So what protections or precautions should I take when I deliver meals? Any ideas about that?
Yeah, so if you're in town and you want to drop off some meals, which is a great thing to do. And last week we talked about, if your family member is resistant to having you do some grocery shopping for them because it might be their only way of getting out and socializing, or they want to pick out their own food. I don't know, rarely will people turn down a delivered meal at their doorstep. You definitely want to look at making sure that you're wearing a mask, a cloth mask, or some sort of covering of your face. Let them know in advance would be a good idea, so that when you ring the doorbell that they're expecting you, and just keep your 6 feet distance from that person. Just drop it off at the doorstep, or hand it off from a distance.
Okay. So a question we're getting in lots of different forms is, how do I communicate? So one question is it safe to continue or start home care services right now? And if so, it's sort of a two-part question. How do I communicate with my sibling that I don't agree with about bringing in home care? So we're getting this question in all different forms about if there's several people who are trustees for a person, an older adult, and they're disagreeing because probably they're in different states with different rules or different interpretations in different cities. So what do you do about that family communication or conflict?
Yeah, I that's a tough one. I think that there always is some family conflict in terms of who, people have various interpretations of what is the best care for this person. So I think first and foremost, it's important to think about, assume good intention. Assume that every family member has some good intention about what's best for the family member. And it probably is best to have some kind of a family meeting. At the Alzheimer's Association, we facilitate family meetings across towns, across states, and so sometimes it actually is helpful to have an outside person to facilitate that process, a neutral party to just kind of ask the questions, identify what the goals are. Is it safe to start home care? It is. I mean, I think it depends on the individual and what the needs are, but certainly there are many families who are still utilizing home care, and it's important to ask the home care agency about their protocols for reducing the spread of COVID-19, taking every precaution possible, but it is possible to start home care for sure. Nicole, do you have anything to add to that?
Yeah, I think what you said is great, is it's about being cautious. If
Mhm.
I were in the market for a home care, one of the questions I would ask is, what other homes is this caregiver working in? And are they working with anyone who is COVID-19 positive? But
Mhm.
also, is the caregiver working in any facilities as well? So I think the answer is, like, one of the recommendations is that staff shouldn't be working in multiple long-term care facilities. And currently some home care agencies, in order to assist, are sending their staff to facilities. So if I were looking for a home care, I'd be asking, like, has this person been in facilities in the last 14 days? And what other care settings are they working in?
Right.
Yeah. Okay. One of our attendees writes in that a great resource for family caregivers is also are the caregiver resource centers in California.
Yes.
And I believe that there's a link to caregiver resource centers on the engageca.org website, which is the California Department of Aging website with lots of resources for family and friends. Okay. Another question we're getting in a lot of different forms is, how do I know what should I think about when I'm thinking about bringing a loved one home? So if, I'm worried about the person I'm taking care of who's in a group living setting and maybe there's COVID positive other residents there, what should I think about in terms of pulling our loved one from a nursing home?
Yeah, that's a big question right now. And I want to highlight that the Engage website has some FAQs about this exact topic on the website. And you can visit that there at engageage.ca.gov. But it's a series of questions. So I can't tell you if it's the right decision for you, but I would ask a series of questions. And the first being, what are that person's care needs and can they be met at home? It's likely that person decided to live in a facility because the care couldn't be provided at home at that time. It's also possible that their care needs have progressed, and so they actually have increased care needs now. Can those needs be met in the home, either by family or, as Edie said previously, by hiring outside caregivers? And is it safe to provide in the home? Meaning, is the home protected as much as possible from COVID-19? Are there stairs in the home? Who is there to provide the care? So really thinking of can we provide better care and support and protection at home than there is in the facility? And part of that is finding out, what is the facility doing to prevent the spread of infection? So if the facility is doing a great job, they don't have an outbreak, there's not significant community spread in the area in which that facility is, you may consider leaving them there. But if you're feeling like, gosh, there is an outbreak and you're concerned about staffing or you're concerned about prevention of the disease, that may be time to consider bringing them home. I think it's also deeply important to know is, particularly if you have someone in a skilled nursing facility and they are a Medi-Cal recipient, is there is not yet guidance on if that resident would be permitted to return. We don't know if there will sort of be a bed hold, if you will, for that person. And because we don't have guidance, if that person is dependent on that skilled nursing bed, I would encourage exercising some caution and discernment before you fully decide. Again, I think it links back to the facility is, if you're getting open and honest communication and your questions are being answered, it may be best to leave them there. If you feel like you're not getting answers and you're concerned about what's going on, then it's time to consider that.
Thank you. Edie, do you have anything to add to that? About bringing someone?
Yeah, I would highlight the point that Nicole made, which is, can the level of care the person needs is getting, can that be met at home? I think it's, the instinct might be, I want to keep this person safe. I want to make sure that they're going to maintain good health, and I can do this better at home. But really thinking back about, why is this person living in this group setting to begin with? And just some of the practical day-to-day needs come to mind. My husband is 6'3" and weighs over 200 pounds. And if he ever needed, assistance with bathing or transferring, I would not be able to take that on at all. And I think even two people it would still be a struggle. So really think about the day-to-day care, and are you able to provide that at home? There's a reason why the person is living in that group setting.
Thank you, guys. We're getting various questions about technology, and just want to point out that tomorrow CDA is hosting a webinar at 1 o'clock about the digital divide. But I want to pose this question here that comes from a listener. So for a senior who has not used a smartphone, what are some tips to onboard him or her to use an app or to communicate? Also to use apps to help them be more active in the home. So generally, how do you train someone who hasn't used this kind of technology before? And this could be someone who lives in the community or in a group setting.
I think we're all learning how to use technology as day by day, week by week. I mean, even those of us who feel like we're tech savvy are still are thrown into learning new technology. So I think first I would say, yes, it's possible to learn new technology. Does the person want to learn new technology? If that's a no, I'm not sure if it's worth trying. I think that the pandemic, in addition to teaching us to be interdependent, it's also teaching us to be creative in how we communicate and how we relate to each other and connect. And so, I think if it's about making sure you're able to monitor the person, the phone is still a great option. The smartphones, if the person doesn't have a smartphone, is now the time? Are they willing to give it a try? I think you really need to know the person if they're interested, and if they are eager to learn, then it's really taking that time to walk them step by step and do that many times. So those are my suggestions. I think there certainly are a lot of online activities and programs and suggestions for keeping people engaged, but is someone interested in online connection is always my first question.
Great. And do you have anything to add to that, Nicole, about someone trying to use technology in a group living setting and what they can expect in terms of assistance from the staff?
Yeah. So I think first of all, is like what Edie said is correct, is that we are all learning, and not to assume that just because someone is older that they don't already use technology or they're not open to learning. I think that's a critical piece. What we're finding from residents is that they really want that video connection, and it adds a lot to the communication. And so I think that's when we come from there, it helps. There's lots of accessible communication that's been great in the last few kind of years, what has been created. So there are options and platforms out there for individuals who are older adults, who are hearing or visual impaired, that can be used. I think in terms of facilities, it's important to remember not to put more on them than what they can handle. So if you're planning an event or you want to do some sort of activity, find out what resources the facility has. Do they already have a tablet or device, or do they need? So at the time we're trying to help, not giving them something they can't use, but really asking the activities coordinator, what can we provide you with that would help you engage with the residents or would help provide activities to the residents? And finding out from individuals who know those people what they think would be beneficial.
Mm-hmm. Thank you. We have one attendee who's asking, how can I find the resources on the Engage website? And they've opened the website but can't find the resources. So I just want to say that the name of the website can be a little confusing. It's engageca.org. It's not engage.ca. It's just engageca.org. And when you go to that website, if you scroll down, you'll find 3 columns. One is finding information and assistance, and it has links to things like the 211 line and the California Department of Aging's COVID page. There's also the middle column is resources on staying connected and engaged. It has things like the activity guides and the friendship line that are used for seniors who or anyone who needs more social engagement. And then the right side column is friends and family, friends and family caring for adults. And that's where a lot of the resources that we're talking about today, there's links to AARP family caregiving, Alzheimer's Association, advanced care planning. And then just to say, if you keep going down, you'll see the different advertisement about these check-in calls. And each of the check-in calls are listed. We had one last week about caring for an older adult in your home. And what we have there is a link to the past check-in calls and then a link to the resources. So under the one that's advertised for today, April 22nd, you'll see about 5 different links with resources like the frequently asked questions for friends and family of people living in skilled nursing and residential care. The role of the long-term ombudsman. So there's lots of links there as well that are really related to our call for today. So I just wanted to point that out, that just, in case it's a little confusing, but just keep scrolling down on the website and there's so many links and resources. I do have another question about people taking care of someone who is in a group living setting. Mm-hmm. So Nicole, can you review again the reporting requirements when there is an outbreak in a facility? One of our attendees would like to just hear those again. And is there a website where I can follow what's happening at the facility? Not just policies, but numbers of tests, diagnoses, how many people have tested positive and how many people have passed away? How do I know if there are enough supplies to care for my loved one? So that's a lot of questions. So they want to know the reporting requirements and how are individual facilities telling people about what's happening there.
Yeah, so let's start from terms of who the facility has to report to. So if the facility has a positive test, they first of all should notify the family member of that individual resident, because that's been a changing condition, right? If they go to the hospital, if there's been a diagnosis. But for the broader community, the facility has been advised to notify, they have to do a couple things, notify their licensing body. So if that's Department of Public Health or Department of Social Services. They also need to notify their local public health. So far they've notified the resident's family, they've notified their licensing body and their local public health. And what's new, and I think what this person asking is for, is like, hey, if it's not my family member, but it's in the facility, do I get to know? And the new guidance is yes, this facility should notify the family members that they have a positive case and sort of what they're doing. California Department of Public Health has just heeded the call and on their website. And so if you'll just Google CDPH positive COVID-19, they have a listing of across the state, the facilities, skilled nursing facilities, where there are positive COVID-19 cases in either residents or staff. I should say it's not sorted by county, so you do need to scroll through to find the individual facility name. So Department of Social Services is also sharing information related to COVID-19 outbreaks, but they are not doing it in small facilities. I'm sure you can imagine in some of our more rural communities, there are not very many facilities. And if they said there's an outbreak in X facility and there's only 4 residents, it wouldn't be that hard to think who it is. So they are sharing information, but you should get that from your facility. So if you had a concern that there's an outbreak in your facility and you're not being notified, you first should ask the facility. You also can talk to your local ombudsman office or the local licensing entity.
Great. And do you know, do most facilities have a website?
So some of the larger facilities, they're going to have maybe it's more of a marketing website like what they are doing. The small facilities will not. It's more of a small business. So again, your best point of communication is going to be with the facility administrator or some form of leadership.
Okay. We have another tip from an attendee who says, there are also family caregiver support programs at other organizations. For example, this is one in Southern California in the city of Los Angeles, St. Barnabas Senior Center provides support and respite for family caregivers. So if anyone's calling in from Los Angeles, St. Barnabas Senior Center has been recommended by one of our attendees as a good resource. We also have a question from a caller. Does California Advocates for Nursing Home Reform have any type of active role in oversight? Are they engaged with the MPA, the Master Plan for Aging? And I would say the Master Plan for Aging is a stakeholder-driven effort to redesign aging services in California. And we have definitely had people from the California Advocate for Nursing Home Reform. We have had them come and present at those meetings. So they have been a stakeholder participant in the MPA. Okay. I think oh, here's a good question. This is for you, Nicole. Are you able to set up FaceTime even for symptomatic residents? So someone who has COVID, are you able to set up FaceTime?
Absolutely. I think that's the most critical time for a facility to be setting that up. Yes, let's say it's a shared device in the facility should be cleaning it between each use, regardless of if someone's positive. Take the appropriate and extra cautions if necessary, but absolutely they have the right to engage with someone, even if they're positive. And something I didn't say previously is, well, general visitation to facilities is prohibited. If there is an end of life scenario, like someone's on hospice, there can be sort of arrangements made for one family member to visit at a time. But absolutely someone should be FaceTiming and whatever engagement is possible if they are ill.
Thank you, Nicole. So we're about at the end of our time. We have a couple more minutes. I really want to thank our panelists today. Nicole Howell from the Ombudsman of Contra, Costa, Alameda, and Solano, and Edie Yao from the Alzheimer's Association. You can continue to send questions to our engage@aging.ca.gov email, and check out our resources at the www.engageca.org. And if you're having trouble finding the resources, just send an email to our inbox and we will send you whatever you're interested in. I want to put in another plug for next week. We're going to be continuing the conversation. We're going to have a really interesting conversation next week with Judy Thomas from the California Coalition for Compassionate Care, and Steve Panelat, who's a palliative care doctor at UCSF. It's called Essential Conversations, and it's about advanced care planning and palliative care and end of life issues in this time of COVID. So it's bringing, this outbreak is making a lot of people want to talk about their decisions for advanced care planning. And this is about how to have those conversations and resources. And then on the next week, 1 o'clock on May 6th, which is another Wednesday, we're going to be talking about caring for yourself while you care for someone else, and issues around respite and stress management for people who are caregivers. So thank you all so much. And we hope to talk to you again next week.
Thank you.
Thank you.